will be a nice respite from the previous 4 weeks. Because you guys have been hitting it pretty hard. So,
4 weeks or 9 hours?
Would be a nice?
Yeah.
Yeah, 4 weeks or not.
y'all just started messing around 4 weeks ago. Yeah. Can you imagine? I mean, this is just nuts.
Are you gonna miss us?
You guys have 2.5 weeks, 2.5 months before you're, you know, I was sitting right there as Lovelace was asking all these questions. When it's just him and you can't be silent. He is going to expect an answer. So, anyway,
Is he gonna be at Preceptor?
he will not, but his 2 clinics might. So I don't know. One of them has already signed up. We'll see. All right, where are we? Okay, creatures that are above cats on the worthwhile to humanity phylogenetic scale. If you need me to interpret that for you, that means, well, you know, let's start with snakes. When you're dealing with snakes, of course, here in the middle part of the country, we're going to be dealing with the crotals, which will be the rattlesnakes, the water moccasins, and the copperheads. I don't know if copperheads are endemic to Oklahoma. I think they are.
They are.
Yeah, but water moccasins are quite common, and rattlesnakes are everywhere. The elephants are the coral snakes, which you're going to run into in Florida, Mississippi, Gulf Coast states, along the East Coast, and to some extent on the West Coast, but mostly East Coast and Gulf Coast. Unless you happen to be keeping a coral snake as a pet, you're probably not, or working at the zoo, you're probably not going to encounter these types of bites. And there aren't a whole lot of endemic cobras around here that I know of. So, one thing you need to keep in mind, though, as far as crotals is about 1/4 of all bites are called dry bites. So if somebody presents to the emergency room, whether or not you treat them, you have to keep that in mind, because the treatment can be not good. You're always conflicted about whether or not to go ahead and start treatment. The earlier you start treatment, the better the outcome. But you don't want to over-treat somebody who's had a bite from a non-poisonous animal or a dry bite. Okay? You'll most of the time know pretty quickly. Okay, so the venom from these 2 genuses is different. The stuff that comes from coral snakes and cobras is more neurotoxic. The stuff that comes from rattlesnakes is going to be more tissue specific in terms of hugely significant swelling to the extent that the tissue actually rips open. We'll show you some pictures here as we go along. Pit vipers are the crotolid family. All 3, the rattlesnakes, copperheads, and moccasins, they all 3 have a characteristic triangular head with a pit that's in front of their nose. It's not their nose, it's actually a heat sensing organ. But I'm personally not going to get close enough to look for the pit. I'm just going to unload the entire magazine and then pick up what's left of the tail of the snake and try to identify it from that. Again, the tissue destruction that comes from the crotolid can be pretty significant. And it's person-specific. If you're bitten, you may respond completely different than the way you respond. You not so much so, you a lot. So it varies from person to person, their reaction to it. Snake bites, you make sure, you want to identify it because most bites are from non-poisonous snakes. Patients will always, a lot of times, bring what's left of the snake in or they'll bring the spiders in for you to examine. Anyway. Stay away from snake heads for a while because they can still reflexively bite for some time after you decapitate it. So, I remember growing up, the guy that lived behind us, he shot a snake, a poisonous snake with the shotgun and blew his head off. And so the snake had no head. And so I said, "Where's the head?" He said, "I blew it off. I blew it up." And I remember at that age, I was like first grade, like, what happened to yeah, but where is it? Where is the head? I think what I was getting to is that matter can neither be created nor destroyed. So, where is the head in space? I ponder that. I still ponder it a little bit. Again, you want to make sure you can identify the snake. This is the mnemonic here for coral snakes. As you'll see in this illustration here, red and yellow are next to each other on a coral snake. On a king snake, though, it's yellow and black. So if you go to that little mnemonic, that will help you to remember which one to pick up and which one not to do, or which one, all of them will unload the magazine. I hate snakes. Not as much as cats, but I hate snakes. Here is a copperhead up there, nice copper color. Moccasins can be anywhere from black, solid black, to black with markings, or dark gray with markings similar to that copperhead. The thing about a moccasin, the cottonmouth, is the inside of the mouth is brilliant white, and it's like a bullseye for that. You put your bead right on it. Rattlesnakes, of course, there are several different species of rattlesnakes, and they're all, even the little bitty ones in the garage that bite you, can produce tremendously bad outcomes. Starting out here with coral snakes, they can produce no symptoms for a while, and then the neurological symptoms will come on a few hours later, and they can produce paralyzing symptoms of the diaphragm and to lead to death. These are pretty nasty little snakes. And coral snakes are little; they're only about that long. They're not big snakes at all. Versus a rattlesnake can be huge. By the way, these people who handle snakes, like at roundups and the religious ceremonies, they're all whacked in the head. Every one of them. Every one of them. Okay. Perioral paresthesias and your scalp starting to itch, those are signs of impending badness. So you need to be on top of them with antivenom and other things. Now when you get to treatment for rattlesnake bites, what to do with rattlesnake bites is always changed. Seems to always be changing. It used to be that you open the bite up with a knife and suck the poison out. They actually made little suction cups that you would put on there to suction it out. Then they decided, no, don't do that, because if you lacerate somebody's skin, it allows the poison, the venom, to hit the circulation and disseminate. So it's better not to do that. It's better to put cold on it. No, it's not good to put cold on it. It's good to elevate. No, it's not good to elevate it. It's always changing. The bottom line is that antivenom is one persistent factor. This is a immunoglobulin against the proteins in the venom. Because you're receiving an immunoglobulin, you're receiving a foreign protein, you can react to that. You can wind up with an anaphylactic reaction to the injection of that foreign protein. Now the way this stuff is administered is it comes in like packets. So if you have a snake bite, and I'm going to start giving you Profab, and I'm going to give you a few packets and the symptoms are worsening, you're still having more swelling, pain, edema, then I'm going to give you more packets. And over the course of 24, 36 hours, you can receive a lot of this medication. Keeping in mind, though, the more you receive, the more likely you are to develop an allergic response to it. Okay? But it's really the only thing that we have to treat snake bites. You don't want to use a tourniquet because of the destruction in the limb itself. There are two things about that. One is you make the limb hypoxic. The second thing is you concentrate the venom in the limb versus dispersing it throughout the organism. So. You have to wait for the system to shut off. I don't remember it saying, it says, oh, there it goes.
Yeah.
Okay. There's a surgical procedure, it's called a Z-plasty, that that can happen in snake bites. If you're bitten, for example here, it's the dependent structure that's going to swell. So the swelling in your forearm, for example, can get so large, so massive, and as I mentioned earlier, it can rip the skin open. And there's a procedure called a Z-plasty where you go in surgery and you cut the skin in a Z pattern, a zigzag pattern, to open it up so it doesn't rip. This is something that will be closed after the swelling goes down. When I was a PA student, there was a guy with a rattlesnake bite on his top of his hand. He was bitten in the garage, and within a few hours, it had swelled. So, I mean, there was no creases on his skin. It was like the Michelin Man. It was huge, puffy. So you want to elevate it. So the puffiness wound up over a day being in his elbow. And then his elbow looked like he had some huge effusion. So then you raise his arm further, and then his axillary region is all poked out from the effusion until it finally hit his core and was absorbed. But it's pretty impressive to see the amount of swelling that goes on with snake bites. Yes, ma'am.
The incision and suction on this slide, is that just saying that's an old way to do it, or do they still do that
That's one
occasionally?
of the old things, always changing. You don't incise them now.
So the only thing on here you do is the anti-venom.
And Z-plasty if you have to. Now you want to also do things like pain control. You can try steroids, you can try Benadryl, diphenhydramine, that sort of stuff. But really getting the Profab on board, which is a trade name, they're different brands. So, of course, if you become shocky, you want to be able to support the pressure with fluids or with pressors. The labs here are basically baseline labs, which you're getting here. They're not curative by any means, and usually you're not going to direct the treatment, but you still need to get them, especially the coag panel here. Make sure you get that. Bees and wasps, the Hymenoptera genus, there are a whole different bunch of different of these types of these bugs here in the state. They're all stinging bugs, bees. The honeybee, the bumblebee is just like its bigger cousin. The paper wasp is the one that produces those types of nests, which is real close to the yellow jacket, which can live in the ground. They can live also in nests. Fire ants, we have fire ants here in the state. mostly the southern part of the state. If you've ever, these things have two things going for them. They bite and they sting. They've got a little stinger. These are little bastards. If you're allergic to fire ants, they can be pretty painful. Weirdest sensation I ever had in my life was when I got bit by a bunch of fire ants on my feet, and it felt like I was walking on pillows for about a week because my feet had swelled so much. It really was a kind of a cool sensation. Because I could see my feet hit the ground, but it's like I wasn't actually touching the ground. It was like walking on a pillow, literally. If you don't know what a fire ant bite feels like, you need to go find you one. When people say they've been bit by fire ants, you need to respect that. There's another bug out there called a cicada killer. Have you ever seen one of those things? You know what a cicada is? They call it something else.
I love this. I love this.
Called what?
I love this.
Yeah, so these things are, they're the things that make the noise, the loud noise in summertime. You see their skeletons on the walls when they molted, right? There's a wasp that kills those things, and it's about that big. It's about 2 inches long, and it's got a stinger that's about 1 centimeter. And it is the most god-awful looking thing you'd ever see. Google it, call it cicada killer. They're around here in this, the first time I ever saw one, I about pooped my pants. Because I thought it was just like a yellow jacket on steroids. They're huge. I mean, they're the size of a freaking hummingbird. They're that big. They're huge. And I've seen one actually killing a cicada one time, stabbing it with that big, it was horrible. Horrible. I don't think that they actually sting humans, but I don't know that for sure. But I think it'd take a shotgun to bring them down. Did you Google them? They're ugly, aren't they? They're huge.
What about horseflies?
Horseflies,
Yeah,
they bite, not sting. Yeah.
Okay.
Those hurt like hell.
They do hurt. They do hurt. Tsetse flies. There are tsetse flies all over the place here. You get African sleeping sickness here in Oklahoma a lot. We get a lot of dengue fever, the plague is here, black plague, so the rodents. A lot of things we're not going to cover. You don't get all that stuff here. There's no tsetse fly in Oklahoma. There's no African sleeping sickness. What's the name of the organism? African sleeping?
Oh.
I don't know what that was.
Trypanosomics.
Trypanosomiasis.
It's what?
Trypanosomiasis.
There you go. It's a type of trypanosome. Yep. Animal Planet.
Monsters Society is like my favorite show.
The what?
Have you seen it? Monsters
We had
Society?
a patient over in at Family Medicine one time. A woman who came back from Africa. She'd been visiting over there, and she said she came in and said, "I feel like something's eating my butt." And so the PA had her lie down, and it was a big old pustule on the back of her on her butt cheek here. That was moving. And so she opened it up with a scalpel and got an inch-long botfly out of his butt. So just because you don't have tsetse flies endemic to Oklahoma or bot flies or anything else, they can go somewhere else and get them and bring them back. What are we talking about here? Okay. Diagnosing stings from these things, they produce anywhere from annoying stings to hugely disturbing stings to some people, irrespective of their allergy status. Some people, they get bit by, stung by bees, it's like no big deal. Others, it's like you think they've just broken their femur. Anyway, sensitivity to it can produce anywhere from mild symptoms that you see here to, of course, anaphylaxis, ergo the EpiPen and all of Mylar's problems with the federal government and how much they charge for EpiPens. Don't wait for this to happen. before you treat somebody with an EpiPen. Pull the trigger on those things pretty quick. Why are these symptoms more severe in a patient on a beta blocker?
It prevents bronchodilation.
Right, the beta blocker is blocking the adrenergic response of the epinephrine that you're given. So that's why you need to be cognizant of that. It's a good thing that EpiPens come 2 in a pack, because they only last about 20 minutes. Anaphylaxis, of course, is the thing that you always are fearful of. Benadryl steroids maintain the airway, obviously. Pepsid, because of the H2 blocker. I mentioned ranitidine yesterday, but Pepsid is another option. Nebulizer, and of course, make sure that you update the tetanus with any sting or bite. If the stinger is in you, you want to get it out of you. If you've ever been stung by a honeybee and you watch it fly away and die, because its stinger is left, along with the sac, is left in you. If you only get one bite, if you're a honeybee, wasp can sting over and over. But you can sit there and watch that sac rhythmically pulse, injecting the venom into you. It's kind of cool. Okay. Papain is the enzyme that's in meat tenderizer. It breaks down protein. Papain, P-A-P-A-I-N. And so what you're doing is you're breaking down the proteins in the bee sting. Also, the bee stings are formic acid, so you can neutralize it with baking soda. Stings of jellyfish are not formic acid, and so you hear about people peeing on somebody that's been stung by pouring ammonia on a jellyfish sting. These things you want to put baking soda. Putting tobacco from a cigarette on there does nothing. So forget that. Black widow spiders, these things are everywhere. I'll guarantee you there's 1,000 of them in this building. The good thing about black widow spiders is even though they bite frequently, people do have bites of black widow spiders frequently, they're usually not that bad. They usually produce a local reaction that, other than a little bit of cellulitis, it's really not that bad. It doesn't produce the tissue destruction that you're going to see with the next spider. They're just painful, and they're everywhere. What? Anybody been bitten by a black widow spider? It's only the female that will bite. The male does not bite. The male is a little wussy thing that's brownish in color, and it's got no good of it. What's the deal with the black widow?
Nothing, I was just gonna ask, have you heard the Black Widow song?
The black widow song? So you're a good shepherd tonight, right? You gotta spend the next 3 to 4 hours. Okay, I'm looking forward to that. Okay. These symptoms here are usually not, I've never actually seen these in a patient who reacted that severely to black widow. It's mostly just a local cellulitis. Okay. Death is rare. So what? I don't even really consider black widow as that bad. It's not that big of an issue. You can treat it with a little topical antibiotic. You can give systemic antibiotics. If you have more significant symptoms, the treatment's related here, but it's all intuitive. Nothing big about that. There is a commercial antivenom, though, to black widow bites, but I've never seen it used. Like I have to quote that. Here is a brown recluse bite. These little bastards are nasty. And these things are everywhere. I guarantee if we pull this thing out against the wall, there's one back there. These things they're about that big, and they have very, very dainty limbs. They are very amenable to squashing. Okay? So they can be anywhere from dark to light. You see how big they are. They're not much bigger than a penny. They're very small, but man, they mess you up bad. The thing that can distinguish you, a spider bite, a brown recluse bite, because that's really the only one that's concerned about, is that the bite produces this black pimple. Now, I tried to find some literature to verify that, but it seems like every bite I ever treated, and I've treated hundreds of these, that turned out to be an actual brown recluse bite, it always had that brown pimple in there, and I've heard that that is coagulated blood. It's a little brown pimple. If you don't have that little brown pimple in an umbilicated lesion, it's not a brown recluse bite. You can see the cellulitis here that's occurring in this person, and this occurs within 6 hours. The reaction to this bite doesn't fool around. It happens, it progresses quickly. It's painful, it's hot. What you want to make sure that you do is mark the edges of this with a Sharpie. So that if you're gonna let them go home and you check them back the next day, you want to with on antibiotics, of course, you want to make sure that that red has not extended past your marks. So that's a tip, a clinical tip. Whenever you see erysipelas or any type of erythema of the skin, mark it with a Sharpie. And tell them not to, or a pen, tell them not to wash it. And so the next day, you want to check them back to make sure that it's not still extending. If it's still extending, you're not treating them correctly. Okay.
Do you know if you can actually feel a spider bite here?
You know, usually you don't feel them. You don't feel them. But within 10 minutes with a brown recluse, you do. Yeah. And most of the time they'll look down and they won't see it. So you don't really know. But if it's got that little black spot in the middle of it, I call it a yes. Okay. So they live in like dark spaces. If you're going to go up into your attic, turn the light on 30 minutes before you go up there. And watch out where you stick your fingers, because bites on the fingers of these little bastards are particularly bad. What happened here? Okay, here we go. This is on day 5. This is on day 5 on the thumb. That's well, this is on day 3 here. That's on day 5.
What did you add?
This is on day 10 right here. That's the same bite. So it progressed from that to that. It is dermatonecrotic. That's the thing about the brown recluse bite. And you can't stop it. There's nothing you can do with plastic surgery once it's reached its end. I remember there was a guy with a bite here on his thigh, and I remember looking in the hole and seeing his femur. I mean, it eats you all the way down to the bone, as it's done this guy. Okay? That's why you don't mess around with these little guys. They're also called fiddlebacks because if you look at them from the top, it looks like their head is the base of a fiddle, and the neck of the fiddle is on their abdomen, like that.
You said they're not easily squishable.
What's that?
You can't squish them easily, or can you?
With your foot, with shoes on. Yeah, they're squishy. They're not like those little jumping spiders down in the basement that are hard to catch up to. These things are just, they're slow moving, they're methodical. You just, if you've got thin legs in my house, you're going to get squished. You thin-legged people sitting on the front row here, y'all might want to eat some bagels before you come over to my house. Okay? Sphingomyelinase D, this is the interesting thing about this enzyme. This is the tissue necrotizing enzyme. It's only found in brown recluse spiders and certain bacteria. So if you go to look at the literature, it's really quite cool. If you don't have anything to do a literature search on this, because There are all sorts of studies where they looked at the cDNA from the microbial sphingomyelinates versus the brown recluse. Like, when did the brown recluse acquire this enzyme? Because it's in no other animal. And did they acquire it from the bacteria? What came first? Did the bacteria acquire it from? And so anyway, you need to look. You need to read some studies on that because it's pretty kind of fascinating. And I'm not going to give you the answer. So, I know Katie's going to do it this afternoon.
Why does it say plumbers?
Huh?
Why is it occupations?
Why is it what?
Plumbers,
Because they're
Plumbers
reaching
are
their
like-
hands back in the dark.
And
Because they're crawling up underneath the houses, yeah. And they have butt cracks. That always have skin showing. Any questions, any other questions about that?
Does it react different with different people?
Yes.
So some you might not have a reaction.
Some you might not have a reaction at all. Yeah. But others, and that's a very good point. They're like, it's the same with all of these animals. People will react differently to it. And there seems to be no rhyme or reason why. Yeah, here's the crater lesion with the thing that looked like it's starting as a little pimple. And that's exactly what it looks like. Systemic involvement is rare, other than just a local tissue destruction. And you might as well not send them to surgery early because the surgeons aren't going to do anything until the tissue has finished dying. There was a study done at OU about 20 years ago on treatment for brown recluse spider bites, and they found that nothing worked. The only thing that worked was late referral for plastic surgery. That's the only thing that improved outcomes. Down around where Macy grew up, one of the treatments for it, and a friend of mine lives down there, he was the one that, he's a PA, he was the one that told me about this because he was doing it to his patients. That when they would come in with a brown recluse bite and that little black pimple, what he'd do is he'd take like a stun gun, the thing with the two prongs and like that, they would zap it, right? The thought is the electricity would denature the protein, but that was found not to be true. Instead, these guys were just getting their asses busted by these stun guns because of the brown recluse bites. Robert Lynch was the one who was so proud that he found the cure for brown recluse bites. Either they're tasing half of Wilson, so.
They did that to my mom.
They did it?
They didn't, but my mom had one and they did that to her. It did, I mean, she didn't react to it bad, like she didn't have a bad reaction, but
Well,
they really did do that.
that was part of the study that showed that nothing worked. The tasing doesn't work either. So that was all for naught. And there you go. Any questions? Yes, Katie.
Could you explain one more time what dry drowning is?
What
Dry drowning?
is the laryngospasm closes up the larynx and you actually asphyxiate rather than have water enter your lungs to asphyxiate that way.
So it's like, it's aspiration. Is it the same thing as aspiration?
Most people who drown take in water into their lungs, but a subset will drown because of the spasm before they even take in the water. All right, see you guys later.
See ya. Stop.